Hi everybody, my name is Mark. I'm the Senior Osteopath here at ML Therapies and I'm also a lecturer at the Irish College of Osteopathic Medicine. So in this video, what we're going to try and demonstrate is a mechanical test for a true or congenital versus functional or non-congenital or non-true leg length discrepancy, whether that be long on the left or long on the right, short on the left or short on the right. Those determinations will be made by other landmarks, assuming we have a functional positive test. One of the assessments that we use to assert or to discern leg length discrepancies would be to measure the medial malleolus after the patient has been lied supine on the table, which is face up. We would ask the patient to bend their knees, place their heels level. We ask them to bridge their hips up, which we obviously can't demonstrate here. They lie back down, which neutralizes the pelvis, and then we straighten the legs out. Once we have those legs straight, the assumption is that the pelvis is neutral, and we then measure the medial malleolus on both sides with the thumb to the inferior aspect of the medial malleolus. We should have level symmetry with our thumbs. What can happen on occasion is we can have, for example, left side long, right side long, left side short, or right side short. Now, what can cause this is an innominate dysfunction. What can also cause this is a true leg length discrepancy. One limb may in fact be longer or shorter than the other. One of the assessments that we use for this, if the patient sits up, the assumption is that once we sit on the ischial tuberosities, the femur is in the socket, in the acetabular socket evenly. The assumption is that if the leg lengths are in fact truly long, it will be the same or be exaggerated. If it is a case that it is a functional problem, the assumption is that the medial malleolus will neutralize or become parallel or level, and that as the patient lies back, we will then see an increase in dysfunction, whether it be short, long, short, or long. So again, just to recertify, if we have a lying positive leg length discrepancy and it corrects when the patient sits up straight, the assumption is that it is a functional problem, which can be corrected through treatment. If it is a case that it is the same or gets worse, the assumption is that it is a true or congenital, which can happen through either a birth defect or can happen from surgical procedures such as hip replacements, femoral bars, etc. Hi guys, thanks for watching the video. It's just a quick little video on true versus congenital or congenital versus functional leg length discrepancies and 8 tests that we can use. There are other tests, but this is one of the clinical tests we use in our clinic. And if you like what you see, hit like and subscribe below. And thanks again for watching, guys. Thank you. Bye-bye.